left, right.
Yo, and welcome to the show. This is a pretty cool episode. We brought on Dr. Lauren Chmielewski of Harmony Plastic Surgery in New York City. She answered a lot of questions I had. She answered a lot of questions that you guys had about plastic surgery. I'm sure you'll have some questions, so throw them in the comments. And let me know what you think. Let me know, will you get plastic surgery? Have you had plastic surgery? Sorry, I had to ask. But what are your thoughts on plastic surgery? And we will share them with Dr. Lauren and throw them back out in the comments. Thank you guys, and see you on the other end. This is SipTalk. Grab a drink and enjoy.
Where's this going?
Cheers.
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 Looks like we are live. Welcome, everyone. This is SipTalk, episode 147. My name is Justin DiGiulio, out of my basement in New Jersey. Joined, as always, by James, the Boswell, out of Charleston, South Carolina. James is an accountant, philosopher, professional bartender, and professional referee. And today we have a special guest, Dr. Lauren Chmielewski. You own, am I right? You own Harmony Plastic Surgery, and you're
That's
a board certified plastic surgeon out of New York, New York. That's Manhattan, New York City, Central Park South to be exact.
Correct.
Welcome to the show, Dr. Lauren. It's very nice to have you.
Great to be here.
So I got to ask you, I heard James crack a beverage during the intro there. Did you bring a drink?
It's SipTalk, of course.
All right. What are you drinking today?
I have a Heineken.
A Heineken. Oh, is it the Heineken Zero?
It's the Heineken Light. It is a school night, but it's Heineken Light. It has alcohol.
It's a school. You're still trying to learn how to become a professional plastic surgeon. You got school tomorrow?
Right, exactly.
Well, fair enough. I got a little Hibiki here. I'm gonna pour in a second. I found some more Hibiki, which has been my drink of choice lately. It's a nice drink out of my wine cellar. It's actually the boiler room in the basement, so I think it actually keeps the beverages warm. James, you got a Bush Ice.
Yep.
Cold? Is it cold today?
Yeah.
All right.
Yeah, I've got a fridge in my garage now. Like I'm no longer living like a heathen. Well, in that respect, at least.
So, Dr. Lauren, it's really nice to have you. We met, was it this spring?
Mm-hmm.
Spring 2021.
March, I think, yeah.
And you were
starting my search.
you were looking to make a move into a new home, which is where you are now.
Correct.
Very
I
exciting.
bought my first home. Big
It
milestone.
Looks a little different than it did before. Did you paint the walls?
I did. Yep.
Okay.
Put
You had
furniture in, got a big old TV. Starting to feel like home. The furniture issue, I don't know if you've heard, has been terrible with the pandemic.
Oh yeah, I told you I moved to Jersey in the fall time, and it's impossible.
Yeah.
It's impossible.
I'm still waiting for a couch that I ordered in May. So
it's if you see something, so you have to shop. So for those of you who aren't aware or haven't tried to buy furniture lately, and this is especially problematic when you make a fresh move because you have lots of furniture you have to buy. If you see something in the store, they don't have it at the store. you have to buy it and it gets shipped to you, and there's major supply chain issues. So
yeah, it's sitting on a cargo ship somewhere in some
somewhere.
port off in California. Yeah.
And then if you see it online, you're just as screwed. Like, at least if they have it on the showroom floor, it's made it into your state at least. But if you see it online, it could be in China or somewhere else. So look, we got lots of questions for you today. First and foremost, we want to know all about plastic surgery. I know nothing about it. I had very, very few thoughts about plastic surgery until we met. And then, I had a lot of questions I didn't really want to ask because our conversations were mostly New York and apartment centric.
First question. Do you do hair?
Do I do hair transplantation? I do not. I know.
Well, it was great having you.
I know a good person who does.
That's great. I'm
so
really
I can
looking.
make a recommendation, but I don't do it. No.
Thank you for that. So, you never gave me a list of things that were off limits, by the way. So
I'll let you know if they come up, but yeah.
All right. Well, I'll do my best.
Yeah, we're gonna ask you to disclose your entire patient list.
Gotcha. That's probably not going to happen.
I'll do my best to try to stay PC. James didn't really run any questions by me ahead of time, so
nope.
No worries.
We'll
Shoot
see
from
how
the
they
hip.
come. So, but look, right off the bat, I was trying to come up with a list of questions for you, and I want to know how you got started, but also, I recognize that at some point in time there was a 13 or 14-year-old girl who was thinking I could be an astronaut, I could be a police officer, I could be a teacher. And at some point, plastic surgery came up, and I assume it's a long setup, right? Like if I just decided I want to do plastic surgery in like a couple of months, it wouldn't be something.
I wouldn't recommend that. I think you got a good thing going on.
Well, it may not be this podcast, but the real estate thing on the other hand. So, but I'm curious, what got you into plastic surgery? Where did you make up your mind to pursue this?
Yeah, so the short story is I didn't know what I wanted to do. So for anybody out there who's still young and doesn't have a career path, like you don't have to be, born knowing you're going to be a surgeon. So I went all the way through college and I still had no idea what I wanted to do with my life, which was a very scary period. But I took 3 years to figure it out after undergrad. And then once you make the choice to go to medical school, that's an additional 4 years after undergrad. And then after you're done with medical school, you then decide on what specialty you want to go into. So I chose plastic surgery for a variety of reasons. We could talk about that. But then that was another 6 years of surgical training after medical school. So if you go all the way through and you know what you want to do, that's a total of, whatever that is, 8 and 6, 14 years of post-secondary education, which is a long road. So if you were going to start that now, Justin, I would say probably not a great idea.
Probably not. I was really considered. It sounds very exciting.
Well, I actually have a very dear friend who is a lawyer and has been practicing. He's, in his early 40s and decided he was going to go to med school and just started. So people do it. It's just, it's a long road.
Yeah. Well, it's also, I am a professional in real estate, but we are not the same level of professionals, right? Like you could graduate high school and become a real estate agent. And if you're good at it, you're effectively a professional.
Different skill set. Absolutely.
And yeah, your skills get honed, but there's a really low overhead to get into it. So you had your mind made up at year 4 or at year 8?
I made up my mind for medicine after college. I did something called a post-baccalaureate program after I graduated, which kind of allowed you to dip your toe into the medical world and see if it'd be something that you like. Plus you have to take all those prerequisite, physics and biochem and all that stuff in order to apply for medical school. So in that period of time, I actually met a mentor who turns out he's a emergency medicine doctor. And at that time, I thought I wanted to go into emergency medicine. So that's what got me into medical school. And then what got me into plastic surgery was kind of the same thing. Like you get to try a little bit of everything when you're training. And for me, it was mostly a process of elimination. It was like, peds, not for me, OBGYN, not for me. And then I started getting into more surgical things. And I loved plastic surgery because we get to do artistry on the human body. It's amazing. So, and that includes everything from, restoring the body after like a cancer operation, to healing a major wound after like massive trauma, to then doing, altering perfectly normal people cosmetically, to enhance something. So it's a really cool profession. You operate from anywhere from kids to adults, women, men. It's really cool. And that's the thing about it too. It's not just, boob jobs and, nose jobs and stuff like that. It's a very diverse profession.
How much of your work is boobs and noses?
Well, I do 100% cosmetic now. So when I first started out, I did much more of the reconstructive and the trauma stuff. I did that for about 3 years. Let's say I got my feet wet. And then I decided just to go and move on and do cosmetics. So that's 100% of what I do now.
It still sounds like a stressful position, but less stress and kind of less
That's in
severe.
a different way. Yeah.
Yeah. I mean, obviously there's a lot of precision involved, I would imagine, but just, I mean, you mentioned you had the colleague in the emergency medical field, and my sister is a PA, and she shares with me some of these crazy stories. It's not something, it's very high stress. It definitely wouldn't be for me. So it sounds like this is a good position for you. Very
high risk, high reward, right? It's very satisfying. Like when you get a good result with somebody, or if you cure somebody, or if you restore somebody back to their pre-morbid state, it's very satisfying. But yeah, it is very stressful. Our malpractice premiums are incredibly high. There's a lot of other stuff that's not as pretty, but it's very satisfying profession when you get to actually do what you love to do.
Now, on that note, you mentioned malpractice. My thinking is that kind of the way the culture has been shifting lately is people are really sue happy. If something's not 100% perfect, they want to sue. Have you noticed a trend upwards? Do you think the premiums are going up because there's the same quality of outcome when it comes to the work that's being done, but just people are kind of getting more picky and what's the word I'm looking for? Entitled?
Maybe entitled is good. I don't know that it's changed much. I think we in general live in a very litigious society, and that goes all over the place, not just in plastic surgery or not just in medicine. I mean, kind of in everything. That's just kind of the way our culture is. I think malpractice has been high for a long time.
I mean, I'm thinking
dependent. It's very, you know what I mean? So I don't know that people are necessarily, they're not going up. They've always been up.
I'm just thinking about malpractice in like plastic surgery, and like someone sues you for malpractice because they don't think that the surgery came out right, and like the best defense would be like, Your Honor, they were ugly before.
May not be the best defense, but you're right, because the majority of people that I operate on are perfectly normal people. We're doing something that they're electing to do, knowing full well all the risk, benefits, alternatives before, and potential complications. But the problem with that is you're starting with a perfectly normal person. So to have any complication is horrific because they were perfectly normal to start with, if that makes sense. But yes, we have to educate the patient, set their expectations, and just let them know all the possibilities, and then they choose to move forward or not,
So I just wanted to, because I want to find out a little bit more about some of the crazy things that you've done, and maybe some crazy stories, and a little bit more about the surgery that you do on a regular basis. But I want to step back because we were just talking about how you got into it, and now you own your own practice. Mm-hmm. So I'm curious, how did that come about? Because I know, as somebody who opened a brokerage, business ownership isn't for everybody. Right. But what kind of drove you to do that? And if you don't want to get into specifics, you don't have to. But I imagine that there's a big leap that somebody would take from just being a surgeon in a clinic and then going on their own.
Yeah. So right out of training, I joined a practice. I was an employed physician with a small group, which for me was a much easier transition, because you're right. When you're training, you're very coddled. There's a lot of hand holding. There's always someone supervising you, and going directly from that to private practice or having your own practice would have been too big of a jump for me. So I did a little bit of a transition period. And during that time, being in private practice and outside of a more academic or hospital-based setting, I learned a lot. So I actually took the opportunity of, during the pandemic, when kind of everything shut down, we weren't allowed to do anything, to do a little bit more research into what does it take to be a business owner? How do you start your own PLLC? All the stuff that they don't teach you in medical school. And I had a couple of mentors help me along the way as well. So I certainly credit them to helping me along. But I knew after being employed for a certain period of time that I wanted the autonomy And I knew the kind of practice I wanted to build, and it wasn't necessarily the brand that practice kind of portrayed. So, you know, it was a huge leap, don't get me wrong. But now that I'm in it and still constantly learning on my feet every single day, I love it. So, you know, I can really, the product I'm putting out there is 100% me. I get to call the shots. I have all the responsibility on the other hand. But, you know, especially in a field like plastic surgery, like you don't work with a lot of other plastic surgeons. We don't tend to be group people.
Mm-hmm.
You know, we tend to work with other specialties, but not necessarily with each other as much, which is, you know, a shame. But most, you know, especially in Manhattan, most plastic surgeons are in solo practice.
Which
so,
props to you. You didn't go and open a practice in like Wisconsin or somewhere in the suburbs. You picked Midtown Manhattan.
yeah,
You're
I
on
was
Central Park.
addressing the extreme need of plastic surgeons on the Upper East Side. Yeah.
Yeah. Well, you get a great location right off of Central Park, so that's very cool.
Yeah.
And do you have pretty heavy client volume already?
Yeah, I mean, I think we're doing pretty well. We had a huge surge right after the pandemic, which we thought was due to like pent up demand because they shut down all elective surgery for a couple of months. They weren't allowed to do any cosmetic or elective surgery. And so a lot of that combined with the fact that people were working from home and had more downtime to recover from surgeries. So that's kind of leveling off now again. And it's going back to, I guess, more normal time or normal volume.
How much of the post-pandemic bump that you saw was liposuction from people sitting on their butts for like 6 months?
Well, I mean, that's the majority of what I do is body recontouring, liposuction stuff. So it was a lot.
Wow.
That was a real thing. So it's funny because you had these two populations. There was the people who got COVID and lost all this weight from being sick. And then there were the people that were sitting at home all day working from home who gained weight. So, you know, there was a good deal of post-pandemic body recontouring.
So a question for you is, my understanding for the most part is that these procedures have pretty much always been for the very rich population, but I'm seeing a lot more of them now. Now, I've never looked into any of these procedures, so I don't know anything about the cost, but I assume that the cost has come down to a more reasonable amount because it's becoming more popular, or maybe because there's more competition in the field. But is it, I mean, you're in Manhattan, so I get that, but is it mostly super wealthy, or do you see a lot of kind of middle class clientele coming through?
Yeah, not at all. So plastic surgery has become extremely accessible to most people. And I think there's a lot of reasons for that. One is absolutely competition. You know, there's, you know, a lot of practitioners, not even necessarily plastic surgeons, but, you know, PAs, nurse practitioners, other specialties who are doing cosmetic procedures. So that, you know, by definition, all that competition definitely drives prices down. There's also, it used to just kind of be, I remember, you know, when I was a young girl and I would look at Teen Vogue and stuff like that, and you would see people in magazines and they were photoshopped and makeup and lighting, but it wasn't necessarily like everyone had surgery. Now with this like era of Instagram influencers and people being very open about the procedures that they've had, it's just become incredibly pervasive. And so I think that combined with the fact that now it's more accessible because there's so many more providers doing it, that it's certainly not limited to the upper echelons of, you know, socioeconomic scale at all. You know, which is good. I think it should be more accessible for people. But, you know, I am incredibly biased, but I would say probably more people than not, you know, over the age of maybe 40 have probably had something done. So
I'm always very, well, we're in New York, so, you know, that may not be the case everywhere else.
Of course not.
Maybe not so much like middle America, but I feel like on the East Coast and the West Coast, it's
you'd be surprised.
but I am constantly surprised, you know, especially at just simple Botox is way more common than I would have thought at all. Sure. So what is the majority? You mentioned you do a lot of like liposuction type work. what I don't know the difference between types of work. How would you classify the different types of work, and what is kind of the most that you do? I assume liposuction and Botox are two separate types of procedures that you do. Are there different groupings for types of procedures, and what do you do the most?
Yeah, I would say there's probably 4 big buckets that you can kind of divide cosmetic plastic surgery into. One would be minimally invasive, meaning the injectables, the Botox, the filler, the lasers, that stuff. That would be one bucket. Another bucket would be breast surgery. So everything from breast reductions to breast lifts to breast augmentations to breast reconstruction after cancer. To body, which is kind of the majority of what I do, which is mostly like liposuction, fat transfer, after massive weight loss or bariatric surgery, kind of skin like procedures, that all goes in the body bucket. And then the last one is face. So basically everything above the shoulders, your face lifts, your neck lifts, your eye lifts, your nose jobs, all that kind of stuff. So those are the 4 big, buckets you can kind of divide everything into.
So you do a lot of body work then?
Do a lot of body and breast. I do everything, obviously, but that's kind of my focus. Yes.
I noticed your logo on your website was kind of like a curvy midsection there. So
it's an abdomen. Very good. Yeah.
I could definitely recognize that. So do you do a lot of Botox? Or sure. That's a pretty regular daily thing?
It's a regular thing. It's become just one of the maintenance treatments for most of my patients. It's just something that also brings patients into the office. I mean, I didn't go to medical school and train for 10 years to do Botox, but it's something that much more people are comfortable starting with. And then as they age and as they get more comfortable with the idea of plastic surgery, they kind of migrate further down the line. And then, when they're ready, they'll, get a surgical procedure with me down the road. So I do a fair amount of Botox and fillers.
And question about liposuction is, how often do people gain that weight back? And how does that work?
100%. Okay. So the liposuction is physically removing fat cells from your body, right? So once they're gone, they're gone. When we do liposuction, we don't remove every last fat cell, because you would look ridiculous. If you would literally were skin and muscle or skin and bones, it doesn't look good. So those fat cells that are left, you can still gain weight. So the way you gain weight is each individual fat cell, you can think of it as like a little storage unit. If you eat a whole lot, it's going to store more fat and grow. And then if you lose weight, that cell, shrinks and you become skinnier. So if I tell my patients all the time, liposuction is not weight loss surgery. It's absolutely not. You still have to maintain a healthy diet and exercise and all that good stuff if you want to keep the results that you get after liposuction. So, some people unfortunately do treat it as, almost a maintenance. Whenever they gain a little weight, they come in, they get their, second, third, fourth round, which is not fun as the surgeon either, because after every time you do surgery, patients heal, they develop scar tissue, it becomes a little more difficult the second time, the third time, the fourth time around. So it's certainly not something that I want my patients to.
Is there internal scarring? Sorry to cut you off.
Internal, meaning, so you're not going, I don't know what you define as internal, but it's under the skin. It's that plain, we call it subcutaneous fat, that's under the skin, but above the muscles. So like in the abs or the belly, it'd be under the skin above the six-pack muscles, that area. So we never go internally. You're never going underneath that fascial muscle layer into where the organs are. That's a big no-no, in fact, and potentially a big complication. So we only address the superficial fat with liposuction.
Now, if you get liposuction and you gain weight again, do you get weird fat? Do you get fat, like, does it go in weird places?
It doesn't go into weird places, but you tend to notice it more in areas where you haven't had liposuction. So again, when you're physically removing some of that fat, you don't have as many cells left to grow and shrink. So like, let's say I do liposuction on your abdomen, your belly's smaller. you then go and you gain 50 pounds, you're going to notice more of a change in your arms than you will your stomach, even though you're going to get bigger everywhere, just because you still have all the fat cells in your arms. We never remove them with the liposuction. Does that make sense?
Yeah, that's what I was thinking. So that makes sense. We got a question. I don't know if I can ask this. Can you I'll throw it out there? Could you remove cartilage in your nose to make your penis larger? I think I know the answer to that is a negative.
I mean, you could do anything technically.
But I have a couple questions.
A more common way to do penis augmentation is with fillers. So the same stuff that we put in the face to augment the cheekbones or the lips, or you can put that in the penis also.
Is that collagen?
It's a cousin of collagen. It's called hyaluronidase. There's a couple different products, but that's kind of the most common one.
So,
and it's temporary. So if you don't like it, and if you do, you have to keep getting it done.
So, yeah, I had a few. I didn't actually write all of them down because I didn't know we'd kind of go in that territory, but that's what somebody's asking. So I had some weird vaginal questions. Somebody asked about making your vaginal area more puffy. Is that a thing? Is that just like a filler injection? I don't have any idea what they were talking about, so I didn't. But you may know what I'm talking about.
I think what they're referring to is as you age, you do lose some of the fat or the padding down there. So sometimes it can be a little uncomfortable, like with intercourse. So a way to rejuvenate that area is to pad it up a little bit. And you can do that with filler. You can do that with fat. There's a couple different ways to do that, but I think that's what they're referring to.
Okay. And then
you're saying that basically any of these filler procedures have a timeline on them, a lifetime.
Not every product we use. The majority of filler products, yes, only last about 6 months to a year, depending on what product you're using. There are a couple that last up to 2 years, and there are some that are permanent, but those are less common.
So a couple more questions. Can you remove your belly button? Could you hide a belly button? I guess somebody had an ugly belly button. They were curious is that a thing?
Yeah, you can do it. In fact, sometimes.
Why?
So,
yeah, I don't know.
I don't know why anyone would do it. I mean, it looks strange, frankly. But sometimes as like a side effect of other abdominal operations, you actually lose your belly button. Your belly button is just this little tiny tether that you had to your mom and the placenta. So there's no functional reason that you need it, but it's just so aesthetically normal to see that. But yeah, you can live perfectly fine without one, and you can get rid of it surgically.
I think your logo has a belly button, right?
Mm-hmm.
Yeah.
Yeah. Very perceptive. I'm impressed.
Well, I was trying to find some images that I could do a little promo with. So I got one of those. And then I don't think this is something that you would specialize in, or it would even be in your field, but can you make someone taller?
Oh.
Now I've heard of people.
The answer is yes.
I mean, this is not something I would do.
Yeah. But would that be plastic surgery?
Of course. Yeah, it would be, because, there are people that are born with like 2 different size legs, and, there's a variety of genetic issues that people can have. So yes, I don't do that, and I don't know the specifics on it, but it is possible.
I've heard a little bit about it. I think it involves like either breaking the legs or like cutting the bone in the legs and either inserting things or letting the bones, like creating a gap so that the bones bridge that gap. And it sounds like a really horribly painful procedure.
Yeah, it's called distraction osteogenesis. We do it in kids a lot of time who have, like, again, genetic deformities, smaller jaws, things like that. It's exactly it. You have to break the bone. You put in an implant device that slowly distracts them while the bone heals in between, and it lengthens the bone. Presumably you could do that to make someone taller too. I've never heard of that, but it is possible.
I've seen pictures of people in the middle of the process.
Mm-hmm.
It looks like it would be really, really painful.
Yeah.
Yeah, I would imagine so.
And you're not going to be like feet taller from that. I mean, this is like a matter of inches we're talking about, but yeah.
Yeah, I would think like that would have its max at maybe like 2.5. I think maybe especially like I can't.
is. Yeah.
Yeah. So then I got another question because I had a couple of these questions, but what is the realm of plastic surgery and how does that differ from other surgeries? Like what
Yes.
what
So,
exactly is plastic surgery?
And why is it called plastic surgery?
yeah, so that's a good point. So it's actually called plastic and reconstructive surgery. That is the official title of the specialty. So plastic just refers to the fact that everything is moldable, malleable, reconstructible. So it's called plastic surgery because we can reconstruct or restore, form, function everywhere on the body. So it's a very broad specialty. And does that answer your question? I could talk about this for an hour, but that's basically what it means.
That's how much we have.
Oh.
Yeah, you get 30 minutes left. So,
no more questions. Just we'll talk about plastic surgery. But that's why it's called that.
So it's called plastic surgery because there's a plasticity to.
It's from the Greek root of plastic, which is exactly plasticity, malleability, kind of remolding that idea of the plastic.
So then what would be some things that would fall out of the spectrum of plastic surgery? Like where would that spectrum end?
Brain surgery. We don't go that deep.
There's brain plasticity.
100%, and we actually do remold the skull for craniosynostosis, which is a skull deformity in kids. So we work with neurosurgeons a lot for that, but we don't actually touch the brain per se.
Well, look, since I obviously am bald, I notice I'm doing a lot of the work out here in Jersey on the house myself, and keep bumping my head on things. Like really freaking hard. I just bought these padded corner covers for the kitchen cabinets because I'll be working on the countertop and boom, I knocked my head.
Why aren't you? Yeah, she beat me to it.
Do you can't wear a helmet everywhere?
Look, it's something that we've been telling you for a long time.
Look, I got a couple of motorcycle
Precious
helmets.
real estate up there.
Yeah.
Well,
we're a branded help. Yeah.
I have a hard hat too, so I go to the dump to drop off lots of garbage that I can't normally put on the garbage, and you have to wear this hard hat. So I got this hard hat that I wear only to the dump. So it's in great condition.
Start wearing it more often.
I'm not about to start wearing it around the house. But have you done these surgeries so I got lucky relatively. I mean, I got some dents in my head, but when I started shaving my hair, I kind of took it down short to like make sure my head shape was not goofy, and I didn't look like a cone head or something. Is that something that would you reshape somebody's head, or at least for my sake, like fill in some divots? Is that a thing?
Superficially, you can do some stuff to adult skulls, but really it has to be done as a child before these sutures, which are the soft spots and the fontanelles in the skull, harden. So most of that stuff, like reshaping skulls, is done when you're a child. Now, superficially, we can grind down things. If you have a bump, we can kind of put a little reinforcement if you have a divot, but we're not going to completely change the shape of your head at this point in your life.
So I got lucky, but you could fill in a divot, right? A little plate.
Yeah. Right. Put some basically plastering a hole in the wall kind of thing.
I've got a question that's got a couple layers to it, but you were talking about how plastic surgery's become more prevalent among just the general population the last couple of years, and you pin that somewhat to Instagram and social media. But there's always been this trend of attention in the media with plastic surgery of some of the people that go way too far with it. Mm-hmm. And stop looking even remotely real. And one of the questions that I have for you is like, every profession has its own kind of code of ethics in terms of what work you can and can't do. And I was wondering, what is the code of ethics in plastic surgery in terms of when do you tell a patient, I know you can afford this, but I'm not going to do this procedure for you?
Yeah. Well, we all, there is a code of ethics. There is, it's always included in like our testing and stuff too. Although how you can test someone's or teach someone ethics, I don't know how that works. But I mean, I could just speak for myself. You know, you have to have your moral compass, and you know, just because you can do something doesn't mean you should do something. So you know, it should never be about the money, right? It's always about patient safety, and it's about making sure that you both have reasonable expectations that you can achieve. So, you know, everyone, I guess, operates a little differently, but that's always kind of the baseline that I approach every patient with, that I think, you know, most respectable, reputable plastic surgeons would also say. So, you know, a lot of times, yes, we can do something, but that doesn't necessarily mean that we should or we will. So
but I noticed I mean, I walk around the streets in Manhattan, and I notice more over the last maybe 3, maybe 4 years, there's some crazier, more extreme body shapes.
yes.
And that's like big asses, big boobs, coupled with unnaturally tiny waists. What do you think is driving that? Is that all like pop culture?
So there are always trends, right? I mean, I think there's always going to be whatever's so hot right now. I think that has been amplified again by the whole influencer, Instagram, Snapchat, all that good stuff. I mean, you know, if you think back to like the 90s, everyone had this like waif figure, you know, like the Kate Mosses of the world and big boobs, right? That was like the look everybody wanted. Well, that's just swung a little bit the other way. And now everybody wants a perfect hourglass, meaning they still want to be big boobs, small waist, big bottom. So it's just what the trend is now. Do I think this is going to be, you know, indefinite? Absolutely not. I'm sure it's going to swing back another way. But you know, while what you're referring to is the Brazilian butt lift, so that's what the procedure is called. This is actually, I mean, people have been doing a Brazilian butt lift since like the 60s, so this is not a new operation in any way. It just kind of struck here with the Kim Kardashian, J-Lo, Cardi B, Nicki Minaj kind of era, where they're very upfront about what they've done. They post their body all over Instagram. It's what everyone kind of sees and models themselves or wants to model themselves off of. So
where does the content come from? So somebody that doesn't have a big ass, where are you putting in like a silicone implant, or where are we getting you taking out of one? Are you robbing Peter to pay Paul? Or
yes.
Maybe Peter's paying you to take from him, but
yeah. So there's you can augment or make something bigger in basically 2 ways, right? You can put something foreign in the body that doesn't belong there, like an implant or silicone injections, whatever. Or you can redistribute fat. So most of the time, a Brazilian butt lift involves liposuction of taking fat away from areas that the patient doesn't want it, and then processing that fat and re-injecting it into areas where they do want it, like the butt, like the breast.
And is that fat live then in the body when it goes back in? And what is
what does processing mean in this context?
Yeah. So again, these are all very good questions. So no, as soon as you pull that fat out of the body, you've taken it away from its blood supply. It is basically dead. So you need to, we call it, it's like sowing seeds, right? So when you're sucking that fat out, the processing means we're taking out like gristly fat, we're taking out oily fat, we're taking out some, you know, blood, we're taking out some numbing medicine. So it's this big concoction that we have to then get down to that good, you know, healthy fat that has a chance of surviving when we put it back in. So that's what the processing means. And often, you know, that means washing it, whatever. I mean, there's different techniques of doing that. Once you have that good, healthy fat, then it's like sowing seeds, putting it back in the body. So you have to put in a lot more than what's actually going to grow, because each one of those little fat cells needs to kind of reconstitute a blood supply, you know, and take hold in order to survive and live. So what happens a lot of times when you transfer fat, you're going to overfill, or you're going to put in more fat than you actually want, because, you know, anywhere from 40 to 60% of that fat is going to die and not make it. Because again, it's like, so
Well, yeah, what happens to that fat after it dies? Like,
it dies, your body reabsorbs it, or it becomes scar tissue, or, you know, it just.
Do you pee it out or fart it out or metabolize it in some way?
No, your body breaks it down, and then, yeah, it goes into the lymphatic system, you reabsorb it, and, you know.
And
just like a bruise, just like, you know, anytime you have any kind of injury.
Okay. Yeah, you're kind of describing this processing of the fat, and I'm getting a bit like, ugh.
No, I'm just thinking like you just like get pots and pans on the stovetop.
There's no pots and pans. Sometimes there's a sieve.
And James and I have seen
Strainer.
Fight Club, the movie, a handful of times. So when we think of liposuction and things like that, have you seen Fight Club?
Of course, yeah.
Okay, I assume so. I think everybody's seen it. But
yeah, I just think about making soap.
Well, that fat is soap, basically.
So I had a question about regulation in your industry.
Sure.
When it comes, so I'm, you know, in real estate, if you tell me you want to live in a neighborhood, I can't basically steer you to a different neighborhood. But when it comes to, you know, what James was asking, do you ever advise people like they shouldn't do that? Is there any like code of ethics or something that's around that like is well known, or something you have to be licensed for in that respect? Like advising
I mean,
people?
there's definitely a code of ethics. Like, you can't date your patients. Like, there are very, like, some black and white rules. But in terms of like your judgment on whether or not you should do a procedure, that's a lot more gray area. You know, and again, I would argue you can't really teach someone ethics or morals. So, you know, you're going to have a range, but most people who have gotten this far in life have some kind of moral compass, and generally, you know.
How often do you turn patients down and say, I don't think that's a good procedure for you?
Yeah, I mean, more often than you think, you know, like a great example, and this is very common, is someone comes in and they're morbidly obese and they want a tummy tuck. You know, number one, you're probably not healthy enough for surgery. Number two, you're going to get a terrible result because you're overweight, you know, and a tummy tuck is not going to make you a skinny person. So, you know, that's a very common conversation that I have with people.
And a tummy tuck is just lipo on the stomach?
No, a tummy tuck removes extra skin, extra fat, and also repairs the six-pack muscles, which a lot of times after either massive weight gain or after having a baby, stuff like that, the muscles get spread apart and it weakens your abdominal wall and you get a bulge. So a tummy tuck is much more involved than just liposuction.
So,
okay, cool. I didn't know.
So they've passed the threshold that you can help them. They're too fat to.
Well, yeah, it's not in their best interest. They're not going to be happy, and I'm really not doing them a service, right? Like,
well, yeah, I'm just thinking it's got to be a very tough conversation. And also, you know, assuming it's so tough because you're recognizing how difficult it is to receive that information.
Of course.
You know, and maybe there's other procedures they can get. So,
like curved mirrors.
Sex change operations. Is that in your wheelhouse? Do you have any experience with that?
Yes.
And what are your thoughts on it?
Become, again, I think with our culture moving and, you know, that being much more accepted in our culture and much more people open and, you know, out of the closet, or however you want to say, it has become very common. It's also now covered by most insurance plans, which also, again, the accessibility issue, it becomes more accessible for many more patients because of that. So yes, I do transgender surgery or gender affirming surgery. Yeah.
So the new word for it would be called gender affirming surgery now.
Correct.
And is that irreversible?
Nothing is irreversible. However, you don't want to have to be in that situation. So that's a good reason. That's patient selection is really important when it comes to that, because you want to see that the patient, you know, is followed by someone for that, meaning be it a mental health therapist, a specialist that can prescribe like testosterone or, et cetera, someone that can write a letter of support for them, meaning that this person has lived in such and such a way for such and such a time, and this isn't just a transient desire. You want to make sure that this person is in a good place generally, and that they're not going to change their mind in 2 years and be, just kidding. I really, identify as this now. So there's a lot of homework that goes into it. Thankfully, I have other people generally do that, and they're ready to go by the time they meet me, but you want to make sure you do your homework.
But that's mostly just to have documents on your side in case you're sued and be like, here's everything that they sent me. I did everything that I could to verify.
Of course, as so much of medicine is, unfortunately, but it's a reality. And also you again, I would be the one reversing it. So I don't want to be in that position in 2 years. Surgery is still surgery, even if it's cosmetic. So
yeah, maybe you just leave like some extra skin, like a good tailor leaves a little extra fabric. Well, I know you're getting this suit taken in, but I'm not going to actually cut the fabric because at least that's what my tailor tells me. Question about like cryogenics or cryo freezing, or whatever this industry where is it bullshit? Are they freezing fat off of people?
So cryolipolysis is a real technology. It is a real thing.
Well, let me ask you. Hold on. Let me ask you first.
Sure.
Do you do it and offer it? Okay. All right. Now I'm open to your answer.
Yeah. It is a real thing. It works for some people. The thought process is there's an external device, almost like an ultrasound probe, if you've ever seen one of those, and it freezes the fat, and then your body reabsorbs the fat that has died, just like when you do a fat transfer and part of that fat doesn't die. So that's the thought process. Unfortunately, there is a complication you can get from doing that, which actually causes the opposite effect. It causes this hypertrophy or growth of fat cells. That is a potential, which is exactly the opposite of why the patient's seeking it out. It also can really only address the very, very superficial fat. It can't go very deep. So if you have a lot of extra subcutaneous fat, you're very thick, it's not going to be able to deal with the deeper layers of fat. So yes, in the right patient, the right situation, it could be a useful tool. It's not something I do.
Yeah, I mean,
I'm just thinking of the conversation that the patient has with you when they come in 3 weeks later and they're even fatter.
Yeah, no. I have a patient right now who had it done for, her kind of double chin area, and it grew. So now she's coming to me to have it actually taken care of.
And is that comparable pricing wise to regular liposuction?
No, it's much cheaper usually, although they get you because a lot of these treatments, whether it's laser, M-sculpt, old therapy, cryolipolysis, you have to go back for several treatments to really see much of a difference. So, once you factor all that in, it becomes a similar pricing, but it is more minimally invasive. You don't have to have a surgery. You don't have to have scars on your body. So people, will often opt for something like that before, necessarily.
Well, we haven't really talked about price at all. So what are some like a basic liposuction of like the stomach area? How much is that going to cost?
So variable. It's so variable.
Ballpark it for me.
Well, it depends on, are you doing it under general anesthesia, or are you doing it awake? Because then that makes a price difference. Are you doing it in Manhattan, or are you doing it in the DR? So it's very variable. And that's why a lot of people actually leave the kind of tri-state area and either fly to South Florida or fly to a different country and have things done because they're price shopping, which in my opinion is terrible because it's your body. You should value something a little bit more than just the cost of a procedure.
Well,
but it varies wildly.
Yeah, generally when you're price shopping, you're very cost conscious, and typically when it costs less, and I find this in many aspects of life, typically when it costs less, it isn't as good. Now that's not always the case.
No.
And oftentimes when it's super expensive, the quality is not there either.
Sure.
I think James, you and I were talking about clothes the other day. Like if you buy really cheap clothes, you're going to get bad clothes. If you buy reasonably priced clothes, you can generally get some pretty solid clothes. But oftentimes when you buy super high-end designer stuff, it's not any better, and sometimes it's actually worse than the kind of regular prices.
Right, or like the maintenance of it is higher. So like, you
Not-
get a really expensive thing and you can only have like it dry cleaned in a certain way, and so
Yeah.
you're right. There is a range, and but I think you also don't make a decision just purely based on price.
So if people are having it while they're awake, would you just be using like local anesthetic, like Novocaine or something?
So usually you try to get some other kind of either oral or light IV sedation on board as well, just to make sure that they're kind of comfortable. Because yes, you're going to use a local anesthetic. The problem is until that local anesthetic kicks in, they're feeling everything, right? So you try to get them a little bit relaxed with some oral, like some pills or maybe a little bit of light IV sedation, and then you're going to use that local anesthetic and then do your surgery. It's a
Now,
little bit of an art to it, to be honest.
for liposuction, are most people under general anesthesia?
No, there's a lot of awake liposuction. There's a lot of companies solely created and dedicated to that model. So it's very common, but you have to have a little bit of experience doing that. And there's a little bit of an art to getting the patient comfortable enough to get through it.
And why would you? I mean, for me, I would instantly think I would want to be knocked the fuck out. Like
Sure.
I want nothing to do with being awake for this. So why would you want to be awake? Would it just be for the dangers of
cheaper.
going under, or would it be mostly cost?
I think a lot of it is cost. It's cheaper because again, you're cutting out that anesthesiology and all that cost. Some people are just afraid of going under, being, put to sleep and have a breathing tube put down their throat. So that's another thing. Some people associate it with less downtime because then you don't also have to recover from being under and all the medications and tranquilizers and stuff they give you while you're asleep. So several reasons why people would elect to have it done awake. But again, you want to make sure you're going somewhere where they're very comfortable doing that and they've got the system down and they can keep you comfortable through the procedure.
What are they using for the IV sedation? Is it just like a medium dose of benzos?
Yeah, so I use mostly oral. I mean, there's a ton of stuff, but yeah, it's usually something like a narcotic for pain, a benzo for, anxiety, some kind of antiemetic just to make sure that, you're not getting nauseous from everything. So some cocktail with those three things is usually what it involves.
So we got about 8 minutes left before we hit the mark here, but I got two questions that I wanted to definitely get in, and I wanted to talk a little bit about traveling for price shopping, and then what are the best marks? So my sister lived in Fort Lauderdale area, which is just north of Miami, and there's a lot of plastic surgery going on down there. She's not in that field. I think she may have considered it, but I'm not too certain. But I know she doesn't work in that field. But there's a lot of that down there. You drive down the street and there's clinics. You see signs for them all over the place. Like you don't see that in New York. There's no signs.
South Florida is the capital for United States cosmetic surgery. It's where the most procedures are done.
So
very unique.
So a lot of people travel from outside of the South Florida area to go there, probably because pricing is good.
Correct.
Now, is there general U.S. regulations that makes getting procedures done in the U.S. safer and superior than getting them done elsewhere?
Well, there is a lot of licensure regulation, and a lot of that is state by state, so it's not completely uniform across the country. But yes, generally speaking, if you're going to call yourself a board certified physician, you had to go through all the steps to get board certified. If you're going to have your surgery done in an accredited operating room, there's certain steps that have to go through to call yourself an accredited operating room. The problem occurs when people just go to, Dr. Wizard and they do no research and that person's not board certified and they're not operating in an accredited operating room. And then that's where people get into trouble. But, the titles in this country mean something. Now, unfortunately, that doesn't translate to other countries. And that doesn't mean that there aren't perfectly qualified, wonderful plastic surgeons in other countries, but the levels or the licensure are not the same. So, it's kind of like buyer beware if you're going to leave the country, and you have to do your homework even while you're here, because there are a lot of people who are not trained as plastic surgeons marketing themselves as cosmetic surgeons, whatever that means. Maybe.
Well, how can you determine whether or not the person that you're talking to knows what they're doing?
Well, you can first of all start with, are they board certified in a specialty that I'm going to them for? And that is common knowledge. You can Google that. You can look it up on the American, boards website. So that's your first step. And you're right. I mean, that is just, it doesn't necessarily mean that just because you go to that surgeon, you're going to get the result you want, or they're the best person for that, procedure, but it's a good way to start. And that person, there's many checks and balances for that person to get to that point. So it's a good start. And then there's word of mouth, obviously there's this review. This is the era of reviews. They can make or break you. So you go online, you check and see what other people have said about them.
That's what I was thinking, is you want to do as much research as possible.
Absolutely.
And, just like when you buy a product on Amazon, you want to look at the 1-star and the really crappy reviews and see if those people are just full of crap, or if they're real severe problems and you're seeing a trend.
Right.
So my next question was then, so we're in New York. We see a lot of people go to the Dominican Republic. I think that's kind of the probably second biggest destination that I know of outside of Florida. I assume it must cost a lot less down there. Where else are people going?
A lot of South American countries. So Colombia, Brazil, Venezuela, not so much in Central America, but yeah, Dominican Republic, Mexico. Mexico is another big one. So South.
So yeah. What about Asia, or is it just the cost of travel there is too expensive? I would imagine it would be somewhat common there.
South Korea is another big plastic surgery culture. So they do a lot of plastic surgery in South Korea, but it doesn't draw a lot of Americans. There's a lot more closer options.
Interesting. Any before we wrap up, any crazy stories that you want to share?
There are many. I have many from my trauma days, but I'll save those because for anyone who might be squeamish. But I took care of this patient as a resident who, before the fat transfer era was really big, what people would do for either buttock augmentation or whatever is they would have silicone injected into them. And not like medical grade silicone, like just liquid silicone injected into their butt. So I took care of this patient in residency who had just all these silicone injections all over the butt and hips. And what happens is if you're just putting liquid silicone into your tissues, that doesn't stay where you want it to stay. What happens is it gets absorbed into your lymphatic system, and then it goes and travels all throughout your body. So this particular person had in someone's garage somewhere, non-medical grade silicone injected into their butt, had traveled down their legs, clogged and mucked up their entire lymphatic system. What happens after that is you swell, you get lymphedema, and then your tissue turns into almost like a wooden texture. It's a very terrible situation. And then you get wounds and that you can't heal and all. It's just a terrible situation. So this person had basically both legs, wooden wounds everywhere, and there's no cure for this. You can't just give them some antidote and it clears all the silicone out. The only way to get rid of it is to surgically debride or remove it, which is then disfiguring, and again, you still have to heal from wounds. So it's a disaster. And word of warning for anyone, getting silicone injections from a non-medical provider is a terrible idea.
Final question.
Yes.
Gotta ask this one. Have you had any work done?
Have I? Not yet. I'm not ruling it out in my future, but not yet. I'm 39 and hopefully
very tactful, James.
Well, look, it's a fair question to ask for someone who does it for a living. Like, would you do it? What procedures would you have done to yourself?
Yeah, I mean, I don't know. I'll see how I age. I mean, if my neck is down here in 20 years, I'm probably going to get a neck lift. But, you know, I'm going to try to age as gracefully as I can and see how it goes.
It's going pretty well for you so far.
Oh, thank you.
When you mentioned, I got a minute to kill here, but you mentioned injecting silicone. James, I don't know if you remember when I had a radiator leak, but I had heard that if you crack an egg and you drop it in your radiator, that the egg will basically
seal up the cracks.
And seal up the cracks. Yeah. I dropped like maybe 4 or 5 eggs into that radiator over the course of a week and destroyed.
Yeah, then your water pump broke.
Water pump broke, radiator broke. Yeah, it did a lot of internal damage. So it reminds me a lot of the silicone.
It's a great analogy.
But look, Dr. Lauren of Harmony Plastic Surgery, thank you very much. It was nice having you.
Thanks for having me.
I had a lot of questions and you answered all of them, so I really appreciate that. And hopefully, maybe we'll have you back soon. You can share some crazy stories from the trauma days. All right, guys, that's it. We are out. Thank you, guys.
Thank you for joining us.
Bye-bye.
Adios.
All right, my friends, that concludes the end of episode 147. Thank you for joining. If you made it this far, please like, share, subscribe, comment, anything you can, any interactions. I feel like I'm begging. I promise I'm not, but we do appreciate it. So thank you very much, and I'll see you guys next time. As always, I had fun. Thank you.
I like PBR. I just got priced out of it.